CNA yeast infection identification. Welcome to the quiz. Question 1. A 70-year-old female resident with type 2 diabetes and peripheral neuropathy was found on the floor beside her bed at 2 a.m. She is alert and states she fell trying to go to the bathroom. She denies hitting her head but reports sharp pain in her left hip when she tries to move her leg. What is the correct sequence of actions? Option A. Do not attempt to move her. Keep her calm and comfortable by covering her with a blanket to prevent shock. Immediately activate the emergency call system to get the nurse to the room stat. Stay with her, reassuring her, and report exactly what she told you and what you observed to the nurse upon arrival. Option B. Try to determine the extent of the injury by gently asking her to lift her left leg. If she can do it with some pain, the injury is probably minor. If she cannot lift it, then go get the nurse. Option C. Go and get a second person so you can perform a two-person lift to carefully move her back to bed, then report the fall and her complaint of pain to the nurse after she is safely in bed. Option D. Since she is alert and moving her extremities, she is likely okay. Carefully help her stand up and walk back to bed. Then put the bed alarm on and document that she was found on the floor and return to bed without injury. The answer is A. Immobilizing a resident with a possible fracture prevents further injury. Option A is correct because moving a resident with a possible hip fracture can cause further injury. Option B is incorrect because asking her to lift her leg could cause pain and is not an appropriate assessment. The nurse should evaluate. Option C is incorrect because moving her without assessment risks injury. Option D is incorrect because helping her stand could worsen a fracture. Question 2. You are feeding a 90-year-old resident with dysphagia who is on a nectar-thick liquid and minced meat diet. She suddenly begins to cough forcefully, her face turns red, and she is wet-sounding respirations. What is your immediate action? Option A. Encourage her to take a sip of water to help wash down the food that is causing her to cough. Option B. Stop feeding immediately, instruct her to lean forward slightly, and encourage her to keep coughing to try to clear her airway. Stay with her and observe closely. If the coughing does not resolve the episode or she becomes unable to cough or breathe, activate the emergency response. Option C. Slap her firmly on the back several times to dislodge the potential obstruction, as this is the first step in managing a choking episode. Option D. Leave her to go get the suction machine set up at the bedside so you can suction her airway if needed. The answer is B. Encouraging natural clearing of the airway is the first step for a conscious, coughing resident. Option A is incorrect because giving water could cause aspiration. Option B is correct because the resident is coughing and has wet sounds, indicating she is trying to clear her airway. Option C is incorrect because back slaps are for complete obstruction, inability to cough or speak, not for a coughing episode. Option D is incorrect because leaving her alone is unsafe. You must stay and monitor. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. A resident with an indwelling urinary catheter has a drainage bag that is full. You need to empty it. Which of the following steps is essential for preventing infection and ensuring proper procedure? Option A. Empty the bag into the toilet. Estimate the amount based on how full the bag looks and record the estimated amount on the INO sheet. Option B. Hold the drainage bag above the level of the bladder while emptying it to prevent backflow of urine into the bladder. Option C. Obtain a clean measuring container, put on clean gloves, place a barrier under the drainage bag spout, open the spout, and allow the urine to flow into the container without letting the spout touch the container. Close the spout, measure the urine. Record the output and dispose of the urine according to facility policy. Option D. Disconnect the catheter from the drainage bag to empty the bag more thoroughly, then wipe the ends with alcohol before reconnecting. The answer is C. Aseptic technique during catheter care prevents introducing bacteria. Option A is incorrect because estimating is inaccurate, and emptying into the toilet without measuring misses the opportunity for accurate INO. Option B is incorrect because holding the bag above the bladder causes backflow, which can lead to urinary tract infection. Option C is correct because it follows a septic technique, using a clean container, avoiding contact, and measuring accurately. Option D is incorrect because disconnecting the catheter breaks the closed system and increases infection risk. Question 4. A resident with moderate-stage Alzheimer's disease becomes very agitated during lunch, pushing her tray away and yelling that the food is poisoned. What is the most therapeutic response? Option A, remove the tray to reduce stimulation and validate her feelings by saying, "You seem very upset about your food. It must be worrying you. Let's take a break from lunch for a few minutes. Would you like to walk with me down the hall and look at the pictures?" Option B, call the nurse to request an anti-anxiety medication so she can calm down and eat her lunch. Option C, try to convince her by taking a bite of the food yourself to show her it's safe, then encourage her to eat. Option D, firmly tell her that the food is not poisoned and she needs to eat to maintain her strength. Leave the tray in front of her and tell her you'll be back in 10 minutes to check on her. The answer is A. Validating feelings and redirecting is more effective than arguing with someone who has dementia. Option A is correct because it removes the source of agitation, validates her feelings without arguing about reality, and redirects to a calming activity. Option B is incorrect because medicating for situational agitation is not the first step. Behavioral interventions should be tried first. Option C is incorrect because taking a bite may not be safe, infection control, and could reinforce her delusion if she thinks you are also being poisoned. Option D is incorrect because arguing about the poison may escalate the situation. Question 5. You are providing perineal care to an incontinent female resident. You notice the labia are reddened and there is a small amount of thick, white, odorless discharge present. What is your priority action? Option A, clean the area thoroughly with antiseptic wipes to kill any bacteria, apply a thick layer of barrier cream, and document the presence of discharge. Option B, gently clean the area from front to back using a soft cloth and peri-wash, rinse well, and pat dry thoroughly. Report your observation of the redness and discharge to the nurse after completing care, as this could indicate a yeast infection. Option C, ignore the discharge as it is a normal finding in incontinent women and continue with the care, focusing on cleaning the urine from the skin. Option D, attempt to wipe away the discharge completely and note in your charting that the resident's perineal area was clean and clear. The answer is B. Proper cleaning and reporting abnormal findings are essential. Option A is incorrect because antiseptic wipes can be harsh and barrier cream may trap moisture. Treatment should be based on nurse's assessment. Option B is correct because proper cleaning from front to back prevents introducing bacteria, and reporting the findings allows the nurse to assess for a possible yeast infection. Option C is incorrect because ignoring the discharge could allow an infection to worsen. Option D is incorrect because wiping away without reporting misses the opportunity for proper diagnosis and treatment. Question 6. A resident who is on strict intake and output monitoring has just finished a 6-ounce cup of coffee and an 8-ounce carton of milk. They also ate a bowl of soup that was 4 ounces. How should you record this intake, and why is accuracy important? Option A. Check the volumes of the cup and carton. Add them together. 6 ounces plus 8 ounces plus 4 ounces equals 18 ounces. Convert ounces to milliliters. 18 ounce x 30 milliliters per Oz equals 540 milliliters. And record 540 milliliters on the INO sheet. Accuracy is vital for monitoring fluid balance, especially in residents with CHF or kidney issues. Option B. Ask the resident how much they think they drank and record that amount, as the resident's perception is most important. Option C. Only record the milk and soup, as coffee is a diuretic and doesn't count toward hydration status. Write coffee, not applicable, in the notes. Option D. Estimate the amounts and write coffee, milk, and soup in the notes section, as exact measurements are not critical for INO. The answer is A. Accurate INO is critical for managing fluid balance in certain conditions. Option A is correct because accurate intake measurement is essential for residents on strict INO, such as those with heart failure or kidney disease. Option B is incorrect because the resident's perception may be inaccurate. Option C is incorrect because all fluids, including coffee, count toward intake. Coffee's diuretic effect does not negate its fluid volume. Option D is incorrect because estimates are not accurate enough for clinical decisions. Great job! Don't forget to subscribe. Bye!